The whole goal of any kind of visual rehabilitation is to try to restore quality of life.
Outside of, let's say, a traumatic injury like a car accident or a fall, and a stroke, which you've mentioned, what other kinds of things might cause these kind like a post-traumatic vision syndrome outcome?
Other conditions, we work with kids on the spectrum. So you'll see different ways of how they're processing visual information. Patients who have cerebral palsy also experience frequent difficulties that involve the visual process. And so it doesn't have to be a traumatic brain injury, but any kind of neurological condition can certainly create problems or imbalances to the visual system that creates more confusion for the patient, doesn't enable them to become independent. So the whole goal of any kind of visual rehabilitation is to try to restore the quality or improve quality of life and restore some degree of independence for these patients.
And for somebody like this, their eyes are working fine, or is there something also wrong with the eyeball itself?
See, and that's the whole trick here is oftentimes people look at the eye doctors as simply looking at the eyeballs. What we try to emphasize to our students is to look at the entire person. Watch how they stand, see how they move in space, how they direct, their movements. Look at their posture. Everything is so important. Yeah, so I always emphasize, look at the entire person, not just at their eyes,
Right.
because the eyes are basically portals of information that transmits information to the brain. When there's a disruption at the level of the brain, there's quite a bit of confusion for the patient. There's mismatch that occurs. And so the patient tends to close in and they start to shut down. And again, they do not go out. The activities that they're usually accustomed to doing at home, they do less. And so it affects them emotionally. And so it's very important for us. It's incumbent for us to be able to work with them very quickly, reassure them, and so it's key to have the empathy for these patients to understand what they're going through
Hmm.
so we can do everything we can to enable them to improve.